Is there anything that particularly stands out for you about West Virginia statistics as it relates to the national statistics?
Sure, sure. Well, one notable data point this year is that Mississippi is leading the country in terms of obesity. For many years, West Virginia did have the worst obesity rate in the nation. You now have the second worst. I guess that's a little bit of progress. Mississippi's obesity rate is just slightly over 40%. You're just slightly under 40%. The state's obesity rate is 39%. So slight incremental progress, but certainly the state has a long way to go. When you think about what the data means, it means that 4 out of 10 adults in the state have obesity. And when we know that obesity is associated with so many serious health issues, and right now associated with very serious COVID pandemic impacts, including hospitalization and death, we have to recognize that obesity is a really serious problem.
What exactly do you think are some of the factors that West Virginia has against it?
Well, poverty is very much associated with obesity, so the state's poverty rate and is part of it. Access to healthy food choices is a problem in many communities. So if you live in a community that doesn't have a full service supermarket, or you're a distance away from a full service supermarket and maybe you don't have transportation there, you don't have a car, or there isn't public transportation available to get you to a full service supermarket, then what are your food choices? And very often your food choices are fast food outlets or a local corner market that doesn't have fresh produce. So your food choices are limited, and you're often directed through no choice of your own at less than optimal food choices because that's what you have access to. Another issue we really need to be concerned about, particularly during the pandemic, is food insecurity. Food insecurity and obesity are related to one another. It sounds counterintuitive, but food insecurity is about not having enough money to take care of, to provide food for your family. And what happens when families are trying to stretch their food budget is they often spend a lot of that budget on low cost foods because they have to. So they're making the lower cost option, they're making the fast food option, they're buying food that is convenient, it's less expensive, but it's high in calories and it's low in nutritional value. And that's leading to overweight and obesity.
So, what are some things that we can sort of do to help this?
Mm-hmm. Well, obesity is a complex problem, and there's no one easy solution. There's no single sector solution. We're going to have to look at across sector solutions. But there are a number of policies that should be in place and investments that should be made that are going to help stem the tide against the obesity crisis. For instance, we need to make sure that our federal nutrition support programs are generous enough to move families out of food insecurity and make sure that they can make healthy choices and put healthy food on the table. Those programs are such programs as WIC and SNAP. And they help millions of Americans meet their food needs, but we have to make sure that they're meeting their food needs with healthy food choices. We should also look at the built environment and make sure that, for generations, we have designed our transportation systems and our roads for the automobile. We should be designing our transportation systems and our roads for both the automobile and the pedestrian and the bicycle rider. So let's give people a safe place to be able to ride a bike, take a walk to school, walk to the grocery store, so people get physical activity as part of their daily routine. Schools are also part of the solution because most kids consume between half and 2/3 of their calories during the school day at school. So let's make sure that those meals are nutritious. During the pandemic, that's particularly important because even though kids aren't reporting to the school building, they still need access to those school breakfasts and school lunches. That's really a critical need for many, many families and many kids. So states are doing a good job making sure that they bring the meals to where students are today, whether that's at the bus stop or a local community center or maybe at the school building. But we need to make sure that those programs continue.
Do you know that if like West Virginia is lacking in any way in terms of policy where they really need to sort of like reform?
Mm-hmm. Well, I'd say that, some things that West Virginia could look at. Now, some of these are federally mandated policies, so the federal government has to act. But for instance, some localities, some cities have experimented with sugary beverage taxes, where they put a tax on sweetened sodas and on sugary beverages to encourage people to make the healthier choice, drink more water, for instance. And in those communities, there is a reduction in the consumption of sugary beverages, and sugary beverages are associated with obesity. And another byproduct is this a new revenue source of monies from the tax to invest in health promotions programs and obesity prevention programs. So that's a win-win. That's something that a city in West Virginia could attempt, a community, a county in the state could attempt, or the state could mandate.
Okay. I think that that's really all the questions that I had. Is there anything that you want to add, or anything that you think I didn't touch on that you want to
Well,
talk about? Or
yeah, I mean, the one thing that I would add is that we don't spend enough money in this country on prevention. Right now, the federal government spends about 31 cents per person on obesity prevention programs. Compare that to the billions of dollars we spend on healthcare, much of which is spent for illnesses that are associated with obesity, like diabetes and heart disease. So if we were to invest more in prevention, we'd save money over time on healthcare spending.